It's been said that the eyes are the window to the soul, through which can be seen each person's wishes, wants, and dreams. It's that kind of perspective and insight with which Dr. Pitt Gills sees his work. A board-certified ophthalmologist specializing in cataract and refractive surgery in the Tampa Bay area, Dr. Gills also specializes in discovering who his patients are and who they'd like to be, free from the limitations of impaired vision. And the results can be amazing. People realizing their dreams of an active life and doing all of the things they want to do.
My name is Pitt Gills, and I grew up in Tarpon Springs, Florida, and went to undergrad at Vanderbilt University, went to medical school at Duke University, then returned home to South Florida and did my residency in ophthalmology there, and then followed up with a cornea fellowship under Dr. James Rousey here at St. Luke's.
Every day you see patients of all ages with a vast array of optical conditions. With so many new corrective options available, how do you find the right solution for each patient?
I specialize in cataract and refractive surgery, and that obviously entails cataract surgery, and then the refractive aspect, there's been a lot of crossover between cataract and refractive surgery, so it's put me in a fortunate situation where we're not just doing cataract surgery, we're using specialty lenses for cataract surgery, and then when we're doing refractive surgery, there's options such as LASIK, clear lens replacement, multitude of different procedures, and we offer all of them. And some of those procedures, such as clear lens replacement, is in essence the same surgery as a cataract surgery. So my two specialties of refractive surgery and cataract surgery definitely connect well. Refractive surgery is basically our patient who wants to rely less on glasses. And that patient may be in their young 20s or maybe in their 60s. And each patient we address as an individual and weigh the risk and benefits for each individual and give them the best option out there. We offer everything that's available in refractive surgery and try to detail or curtail their plan to whatever fits them the best. And in some cases that may be LASIK, some cases that may be a clear lens replacement, other cases just a relaxing incision, conductive keratoplasty. There's a multitude of different procedures, and we specialize it to each individual. Refractive surgery also is very special in this area because there's so many outdoor activities, people enjoying triathlons, fishing, diving, and refractive surgery truly lets them go out and enjoy the life they want to.
LASIK surgery has become very popular in the last few years, although it may not be right for every person. How do you evaluate whether an individual is a good candidate for LASIK?
LASIK is an exciting area of refractive surgery and has been leading refractive surgery for some time. The important thing with LASIK is to know what the limits are, what's going to work well, and what's going to fit each individual. What separates us from other LASIK centers is that we are offering everything else as well. So we're not looking at every single patient as a potential LASIK candidate, we're looking at them as an individual and what is going to be the right refractive treatment for them. What's going to fit that individual the best to give them the best ability to enjoy their life and what they enjoy doing. And since we're all unique individuals with different interests, we really try to listen to the patient and tailor-make our LASIK treatment or our refractive treatment to that individual's needs.
It's well established that St. Luke's Cataract and Laser Institute, founded by your father, Dr. James P. Gills, is world-renowned and one of the largest freestanding ambulatory eye care centers in the world. How does operating in such a large and dynamic facility benefit the patient?
St. Luke's has been on the frontier as far as developments in cataract surgery for decades, and my dad has been definitely an influential person in the world of cataract surgery. It's been exciting to see that continue on as we've tried different new technologies, new lenses that are available, and we're in a fortunate situation where we get to try just about every technology that comes down the road. We get to use our best opinion, our best judgment to pick the right lens, and the new technologies aren't the best technologies always. So we're always trying to pick a lens that's right as if that patient was a family member of ours.
St. Luke's offers a very compassionate, committed, and community-minded approach to eye care.
St. Luke's philosophy has been around for decades, and I was fortunate to grow up around it, and so I know the part of serving others is the number one reason that St. Luke's has done well. and keeping the patients as the #1 priority takes care of everything else. And that's what we're about, and that's what we do. I try to think of every patient that comes in who's getting an evaluation, whether it's a refractive evaluation, cataract evaluation, we try to think of them as a family member. What would we do if this is our mother, our brother, our sister, and truly try to address it in that format. And that works well, and it works well for the patient, works well for St. Luke's. Our staff here, we've been very fortunate to be blessed with staff that are truly caring and really make St. Luke's the family it is.
Thousands of people from more than 75 countries around the globe make their way to one of the world's largest eye surgery centers, focused on one thing: seeing the best. At St. Luke's Cataract and Laser Institute, from cataract surgery to LASIK, Dr. James P. Gills and Dr. Pitt Gills have the expertise you can trust.